Welcome back. If you followed our recent in-depth video series, Stories of a Startup, we gave you a look at PreferUS from all angles. From our humble beginnings in development and navigating a foreign market while searching for the right business model. A model that fits both a need in the China healthcare market and our resources from long-standing partnerships with major healthcare institutions in the US, China, and Jakarta that we established. In my last video, I hinted at a major announcement coming this summer about the future direction of PreferUS. I recently sat down with PreferUS Healthcare founder and CEO Mike Franz to discuss where PreferUS is headed in China. In our sit-down, we discussed the pandemic and how PreferUS, being a China-based company, has been impacted. He also explains how this last year and a half has challenged the company, made us step back, reassess, and ultimately emerge with a clear direction and a resolute purpose. I also get his perspective on PreferUS's journey over the last decade and why, when the odds may seem stacked against you, having patience and persistence can help separate you from the rest. Here's our interview. Enjoy. Well, Mike, thanks for taking time to sit down with me. I know we've got a lot that we want to cover, but first, I know that there's an announcement that you'd like to make regarding PreferUS's future in China's healthcare market.
Well, there is, Dave, and thanks for having me. I think you know well, we've discussed it, that PreferUS was early to China. We understood this, and we started by learning about the Chinese people, about the culture, but also establishing relationships with the key senior orthopedic professors in China. Additionally, we started a consulting and management business as we searched for the right model. And that right model would have three characteristics. One, there would be a strong and sustainable market. Two, that there was recognition and support from the Chinese government, which is always important. And three, it would fit our U.S. partner resources. In 2017, we understood that in the China orthopedic market, in spine and total joints, there's a very small gap between the West and China. But in sports medicine, there is a much more significant gap. And in 2018, we established a proof of concept partnership with the Gongli Hospital in the Pudong section of Shanghai. This was called the Gongli PreferUS International Sports Medicine Center. And it allowed us to test the market for sports medicine. We trained China-side sports medicine surgeons, and we brought Western sports medicine surgeons to China. And we concluded that with sports medicine, there is a very strong fit for those three key criteria that we were looking for. So today, we are publicly announcing PreferUS's entry into the China orthopedic sports medicine market with the goal of establishing a chain of sports medicine centers throughout China.
Well, that's very exciting and perhaps even game-changing, and it certainly creates a clear focus and opportunity for PreferUS. But tell me a little bit more about this new major partnership announcement.
Sure, Dave. We are very, very pleased to announce a major partnership expansion with one of our founding partners, the Kerlan-Jobe Orthopaedic Clinic. Now, this new agreement is a long-term exclusive arrangement and allows us to utilize the Kerlan-Jobe brand and the Kerlan-Jobe human and clinical resources in both China and Indonesia. Essentially, this agreement is about taking Kerlan-Jobe to China and beyond. And for us, it's a rare opportunity to utilize the brand and the resources with arguably the top sports medicine group in the world in our future chain of sports medicine centers in China.
Well, the last year and a half has been interesting to say the least. The pandemic happens and everything seemingly comes to a halt. But what was your initial reaction as the situation became more serious and how it would impact PreferUS, not only in China, but also in the US?
Yeah, that's a great question. At the end of 2019, we had concluded that the sweet spot for PreferUS in the China healthcare market was in sports medicine. We had even identified the first center location in Shanghai. We negotiated a deal to acquire an outpatient surgery center, and we secured the initial funding for the first center. But then COVID-19 hit. And after 3 or 4 months, like the rest of the world, we were all trying to make sense of the pandemic. But we found ways to negotiate partnerships after the deals were postponed in 2020. And we also understood and found a way to adapt to the negative impact that COVID had on our US and China training business and the resultant loss of revenue. We had our executive vice president of China operations, who was a US citizen stationed in Shanghai. He was stuck in the United States. But like most companies and most people, we adapted. Our China team was able to get back to work in the last half of 2020, and now we're positioned and we're ready to execute as China opens up again.
Let's go back for a minute to 2008, when PreferUS came to be. China was identified as the market, and healthcare was the industry. But 25 years earlier, you were working closely with the Japanese, an entirely different industry. If you were to take both experiences and compare them, what principles or methods were you able to apply to the Chinese business mentality from that of the Japanese? And if so, are those methods still applicable today?
That's another very interesting question. So Japan and China are obviously different countries with different cultures. And we were talking about 2 different industries. And the role of government in China is much more involved than it is in Japan. But Japan is more evolved and experienced in doing business with the West. But the opportunities to enter and help define new markets in China are much greater. And the overall market potential in China is much greater because the population of China is 10 times that of Japan. Additionally, I would say that timing of market entry is very, very key. You always should bring something that the markets and the government wants. And maybe the biggest principle is you can't force your way of thinking and your beliefs on different cultures in different countries. You must totally adapt to the culture, to the system, and to the way of doing business in the country that you're working in.
It's pretty surreal to look back at 2008 when this company began. At the time when PreferUS entered the China healthcare market, there were other similar companies that had been in China earlier but weren't able to last. Are you surprised by PreferUS's longevity in such an evolving country and industry? And what can you attribute this to?
So I would say without question, we survived because we understood that we were early to the China market and that we knew we had to make an effort to understand China much better with respect to the people and the healthcare market in China. So we studied the China healthcare market, what worked, what didn't work, where were the China people being underserviced in healthcare, and where were the biggest gaps between China and the United States in healthcare. We also worked to understand what was the attitude, the acceptance level of the China patient for the Western services that we envisioned bringing to China, and how much would they value those Western healthcare services. And we developed very important, I think, relationships in China with the most senior orthopedic professors, which would be very key to us later. And very importantly, we didn't jump too early into projects, which would be cash draining, which were probably too early and also, we believe, probably killed other early ventures that went to China in healthcare. So the first phase of learning and relationship building, not investing too early, combined with the consulting and training and management projects that produced revenue to cover our operating expenses, all those things combined really give you a net answer that we're still here today because of the discipline and the patience that we were able to exhibit in seeking and now finding this sports medicine market opportunity.
We're halfway through 2021, and already there's a lot of momentum behind the development of a new sports medicine business and bringing all the necessary pieces together. But how do you envision PreferUS in 2022?
Well, first I would say that we're very excited about the prospects for 2022, especially after coming off a global pandemic that we've all been impacted by. But in 2022, we expect to launch the first sports medicine center in Shanghai in the first quarter of 2022. But we also expect to be working on the city, location, and the plans for a second center by the end of 2022. Now, added to that, I would say that the goal of expanding the relationship that we have and the partnership that we have with the Golong Hospital Group and their chairman, Dr. Goa, is something that we're very excited about in 2022. We are investors in the Golong Hospital Group. We've trained over 55 of their doctors, nurses, and administrators at our U.S. facilities over the past several years. I am very, very honored to also be the CEO of the Golong Hospital Group. So we expect and we really look forward to an expansion of that partnership in 2022.
Lastly, there's a very good chance that this interview could be seen by an aspiring entrepreneur that has big goals, but also is hesitant to take that next step because of the unknown that lies ahead. PreferUS, from the beginning to now, has been full of many unknowns, and yet the company has found a way to press on. What advice would you give to this entrepreneur who has a vision, but also fears the unknown?
Well, first I would say that if one has a fear of the unknown, then maybe going the entrepreneur route is not the right move. But if you take the word fear out of the question and maybe put in a healthy respect for challenges of the unknown, then to that I would say big whiteboards and an ability to map out multiple paths or scenarios is a must. And I think the ability and willingness to change directions when the market is telling you something new is key. And the ability to keep running into walls and getting back up and going after a new opening is a must. And the ability to keep pursuing your vision even when most are telling you that it won't work, then the satisfaction of overcoming the odds when most of the people are telling you no will be a huge, huge reward. You know, I did a great startup at the beginning of my career, but this China venture in the healthcare market, PreferUS, is by far the hardest of anything that I've done. But our team's patience and persistence and an unwillingness to quit and a drive to find the right market opening has been unbelievably critical. And it's brought us to the point where we are today, which is being in a position that we have a real opportunity to be a major success in the China healthcare market. I think that the big execution lies ahead. We are very aware of that, and we're ready for that challenge. But to your original question, I would say be disciplined and have an unrelenting will to win.
We at PreferUS are thrilled for what lies ahead as we proceed into the sports medicine market. Our partnership with Kerlan-Jobe is a great accomplishment, and now the real work will begin. We look forward to bringing you along and continuing to share our story.